At Dornier's core, we enjoy the family culture of helping people inside and outside of the organization. Our technology makes a difference in the lives of patients. Although there are many reasons why we are here, ultimately, we do our jobs for the patient.
I'm a chronic stone former, and I've been forming stones since around the year 2000. I wonder how many of you have ever had a kidney stone? Has anybody in here had one? Okay, you know how painful they are. They say they're like giving childbirth, you know, and if that's true, then I have about 23 children, so. You know, if I'd been born in another generation, I wouldn't have had access to this technology. And, you know, when I first started having the kidney stones, they started out really small, and they would come every year and a half or 2 years, so it wasn't really bad. And they would do the ureteroscopy lots of times on those. And then something happened with my body chemistry around 2010. Not really sure what that was. I became hypercalcemic, and my pH levels were like 4.5, were really acidic. And so I started forming larger stones. They started getting much bigger. They started out around, you know, like 6 millimeters and 10 millimeters, and they wouldn't come out of the kidney, of course. They were too big, so I'd have to have the lithotripsy. And, you know, it was very painful. I'd get really bad infections. Some mornings I'd wake up and I'd hurt so bad I'd have to crawl on my hands and knees to get to the bathroom and you know, make arrangements to get to the doctor and whatnot and get the lithotripsy. And then they just started occurring a lot more frequently even than that, and getting a lot larger. They would go from 2 millimeters to like 15 and 16 millimeters within 3 to 6 months. So I was just firing them off, just boom, 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 boom. And I was working a full-time job, had a lot of responsibility, and it's very difficult because, you know, you're in a lot of pain. You have to schedule the lithotripsy. They burst them up, and sometimes it takes 3 to 6, you know, 3 weeks, and it can take as much as 6 months to pass everything. And it can be really painful all over again. But I also have immune deficiency, and from time to time I would get E. coli infections along with the kidney stones, and I would get septic, and there was a couple of times I was in the hospital for 30 days at a time. And the only way, you'd have to clear up the infection before they could do the lithotripsy. And but they would be so large, like 16 millimeters and 21 millimeters, that there was no other way to get them out of my body except through the lithotripsy. So, you know, just having that technology, I mean, I don't know what people did before, you know, they had the technology. I guess they perhaps died, you know. I don't know, you know, there was surgery that could be done, but how many times can you do that surgery? Certainly not, you know, 20 to 23 times. But also the other technology that is used is the laser technology, and sometimes lately, because the last ones I've had have been so large, they have done both the procedures. They do the lithotripsy to break the stone up into bigger chunks, and then they use the laser to go up inside the kidney and to kind of obliterate, I guess, for lack of a better word, the remaining stones. And they come out more powdery. It's easier to pass than the lithotripsy. Sometimes it's a little more gravelly, and when it comes out, it's very painful. I mean, I could be driving down the interstate and just, you know, start feeling these pains, and it's like, oh, I'm about to pass some kidney stone that's left over from the last procedure, and that might have been, you know, 3 months ago. So the laser has been very, very helpful too. I mean, you know, it's like you look forward to it, believe it or not. You look forward to having those procedures and getting that foreign particles out of your body. It's been amazing. Like I said, I don't know what I don't think I would be here, you know, if it weren't for the lithotripsy and for the laser surgery, the laser type surgery now that makes it a little bit easier on me. I don't know if that's something that y'all hear from your patients or not, but that has helped a lot with the comfort of passing the stones. And you know, since 2010, a lot of things have happened, you know, and like I said, I was in the hospital at least twice for around 30 days each time, and unconscious for 5 days on one of those situations, and they didn't really know if I was going to make it or not. But, you know, since that episode, I, you know, had the lithotripsy and had the laser procedure, and since then my daughter got married. I got to see her, you know, get married and plan her wedding and go to her wedding, and in 2014 Sophia showed up. So, you know, I just, you know, I'm just really, you know, want to tell you how touched that I am by the work that you do, and I know it's saved my life and it's made my life richer, and you know, I've been able to enjoy more quality of life and in the future, and I look forward to the future. There was a time when I was so depressed I didn't look forward to the future, but now I do. So I just wanted to extend my appreciation.